how old was Terry when she died?
40.
40 years. 40-year-old mother and wife died. When you go through a medical malpractice case with an attorney, over those 4 years, things happen, right?
Yeah, a lot of things happen in 4 years.
Depositions get taken. Your deposition gets taken. Steve's deposition gets taken. And you have to help the attorney, at various times. Each time the telephone rings, each time you get an email, each time you have to do something, it brings it all back, doesn't it?
Every bit of it.
It's a real horror.
To this day.
How hard did the hospital fight this?
Harder than I thought they would, for sure. I don't think that they thought there was any wrongdoing within that facility or with that particular physician. I'm not sure why we fought or why it was fought so hard or drug out for so long, but no, I don't think ever saw a malpractice suit or losing to a malpractice suit.
Welcome to Bayou Justice, Breaking Victims, Protecting Power. I'm your host, Chip Wagar, a medical malpractice attorney dedicated to reforming Louisiana's healthcare laws. On this show, we dive deep into the challenges faced by patients in our state, exploring how current laws often favor institutions over individuals. Each episode will bring you compelling stories from victims, insights from legal experts, and perspectives from lawmakers. Join us as we work to shed light on these issues and push for meaningful change in the Bayou State. Welcome to Bayou Justice, Breaking Victims and Protecting Power. It's a production of the Louisiana Patient Rights Advocacy Forum. We're here today with Jessica Dunlavy. I've known Jessica for several years now. Jessica actually works in the healthcare industry. She's a registered nurse, and she has been willing to come here today to talk a little bit about medical malpractice and the medical malpractice system in Louisiana, since she's had a front row seat and experienced what it's like to go through the whole process. Jessica, welcome to our show. Why don't you talk a little bit about what do you do, or what is you're a registered nurse.
Yes.
How long have you been working in the healthcare industry?
So I've been a registered nurse in the healthcare industry for coming up on 11 years. I've had a little bit of peds, a little med-surg, and currently I am the director of a home health agency.
And home health care, for those who might not be familiar with it, these are people who need continual health care in their homes because of medical conditions that have happened to them.
Correct. Disease processes, wound care, a plethora of things that patients can't manage on their own, and they need medical treatment inside their home.
And so you supervise people who go to their homes and give them the medical care that they need.
Yes.
In between doctor visits or whatever else.
Correct.
But you've also worked, though, in a hospital. You mentioned med-surg. Maybe some people don't know what that is. What is that?
It's medical surgical floor. Patients come in with general surgeries, disease processes that have exacerbated hypertension, COPD, CHF, urinary issues. Med-surg is kind of like the overflow for all things that come into the hospital that don't require ICU or a specialized floor.
And you've worked in some pretty large hospitals and large medical organizations with lots and lots and lots of doctors, nurses, and staff and so forth. Is that right?
That's correct.
Well, let's talk a little bit about medical malpractice. We're going to talk about something that happened to you in 2019 in a few minutes. But before that happened to you, before 2019, even though you worked in the medical industry, what did you know about Louisiana's medical malpractice system?
Nothing.
Does that have anything to do with why you're here today?
Absolutely. You go into this field, and even your common people who aren't in the medical field, there's no one looks for a reason to know what the laws are for medical malpractice until you're facing it. And even then you don't look until you're literally in the moment of what you may or may not be entitled to.
So there you were in 2019. You didn't know anything about the medical malpractice system. You're working in the industry, however. I've read statistics, and I think it's pretty undisputed nowadays, that medical malpractice is the third leading cause of death in the United States. And that when you take vehicular deaths and gunshot deaths, both suicide and homicide, medical malpractice kills 3 to 5 times as many people as those two combined every year. Another statistic that I think has been researched, and you can look it up, in the United States, generally, you have a 1 in 10 chance, 1 in 9 or 1 in 10 chance when you walk into a hospital of being injured or killed at that hospital from a medical error. From your experience working in hospitals and so forth, have you seen medical malpractice? How common would you say it is?
It's common, not anything that I've seen a lot of. Mistakes and injuries, yes, but as death or permanent injury, I have not personally witnessed on a professional level, more on a personal level.
On a personal level. So there are mistakes that we're human beings, and hospitals
Correct.
are full of human beings. There are lots of medical errors that get fixed in the hospital and don't cause any permanent injury or death.
That's correct.
But then there are those few that are devastating injuries that can happen in a hospital that do cause permanent injury, catastrophic injuries, and death even.
Yes.
Tell us now, let me take you to the fall of 2019. Something happened that summer, beginning in the summertime, I think something happened. September was the admission, right?
Correct.
Okay, but something was happening to your best friend, I think, in the summer of 2019. Tell us what happened, and tell us about that.
So for as long as I've known her, she suffered with headaches.
And we're talking about Terry Dunlavy here,
Correct.
your sister-in-law and best
sister.
friend.
Yes. So for as long as I've known her, she'd suffered with headaches every day. That girl took Excedrin migraine. And then fast forward to September of 2019, and she was almost like a demented patient, Alzheimer's. Couldn't remember things, couldn't find things, slow to respond, confused, just completely out of her norm. Ended up in the hospital, and then was diagnosed with a large frontal lobe meningioma, which is, in the front of your brain.
Now that's a form of a tumor.
Correct.
But it's not a cancerous tumor.
Correct. It is benign.
And
is
it's
not
treatable.
Cancerous. Yes. You just have to remove it. And some of them are slow growing and small, and they don't remove them. They monitor them. But in this case, it was affecting her, and it had to be removed. So she was transferred to a different hospital and treated by the neuro team. They took her in for surgery. It was, supposed to be a 6-hour surgery, and it ended up being 12 or plus hours. At the time, we weren't aware of the extent of surgery or what happened. And we really didn't become aware until we got medical records of what really happened in the surgery or during her surgery. She progressed. She did well. She came out of surgery. The next day, she was up, not, ambulating on her own, but with assistance, walking and talking. I brought her some food and fed her, helped her eat, walked her to the bathroom. The next couple of days, she was walking around the floor, trying to get to rehab, was discharged from the hospital to rehab, and then in less than 24 hours, she was unresponsive, had bled out in her brain, and ended up back in ICU. And then for the next 4.5 months, she laid there and suffered and ended up with, a trach and a peg tube and catheters and IVC filters and removal of part of her skull and in surgery several more times than I can count, emergency surgeries and washouts, and just 4.5 months of torture, pretty much, trapped in her body.
And what did they tell you had happened to her?
Well,
or was it just one thing, or did it change?
it wasn't really this is what happened. It was I think she had a stroke, and then it turned out that it was a hemorrhagic stroke. I think complications from surgery. What really happened, we didn't know until we got medical records.
Would you say now, knowing what you know now, looking at the medical records, that there was a cover-up?
Yes.
What really did happen?
The day of surgery, the tumor was removed, and there was a hole, an opening between her skull and her ethmoid.
Her ethmoid sinuses.
Correct, which allowed direct air directly into from the outside into her skull cavity on the brain, and they had covered it with a small piece of Duragen or something that shouldn't have been used, and it failed. But we didn't know it failed until probably October or November-ish.
And then there was a matter of loss of blood, too.
Correct.
She lost a lot of blood in that surgery.
She lost all of her blood in that surgery.
So she had to have a transfusion.
During surgery, yes, of packed red blood cells, platelets, and cryo.
And there wasn't any clotting ability for a while with her system, right?
Yes.
Well, what about that? What happened with that?
So there was an order to hold anticoagulation therapy, which would be heparin or Lovenox, until she went to rehab. But for some reason, it was administered.
Anyway.
Yeah, shortly after surgery, 3 times a day. And then by the time she made it to rehab, she had a pounding headache, and less than 24 hours, she had a platelet count of 0. So essentially no sticky factor in her blood.
So because of the administration of anticoagulants to a patient that didn't have much clotting ability, she had a cerebral hemorrhage.
Correct.
And she never recovered from that.
No.
Was she able to talk?
After surgery, yes.
After the stroke?
After the stroke, no.
She lived in that state of being unable to speak for 4 or 5 months?
September to February.
So, and she died.
Yeah.
So she died of an infection in her brain. Several infections in her brain that got into her brain through that hole that they left between her sinus and the brain. The brain is a sterile area.
Correct.
But the sinuses are not.
No.
And the air we breathe, there's bacteria and stuff every day.
Exactly.
Okay. Tell me a little bit about her family.
Well,
that she left behind.
So Terry was, Terry was the end all be all in that family. I mean, it started and stopped with her. She cooked breakfast, lunch, and dinner, scheduled every appointment, attended every appointment, scheduled all maintenance. Whatever needed to happen, she did it. She paid the bills, bought the groceries, basically took care of everybody. Her husband went to work. He came home to a meal, took a shower, watched TV, and went to bed. He thought about nothing in the home or outside of the home except going to work and coming home. She took care of her daughter, who relied on Terry.
A little more than normal children,
yes.
Right?
Terry attended all of her appointments as well. Basically, her caretaker. And then you rip that rug out from under them, and they have no clue how to pay the bills, how to cook dinner. Obviously they can perform their own hygiene, but past that, they didn't wash clothes prior, or cook dinner, or make appointments, or pay the bills, or balance the checkbook. That all happened with Terry.
How were they impacted after the stroke and watching Terry decline and die over 4.5 months?
It was hard. No medical background. They have no clue what you're saying or what you're trying to do or what the treatment is or what the medication does. So basically they sat in a room with her for 4.5 months and just watched her deteriorate to nothing.
And you were there too?
For the majority of it, yes.
And you do have a medical background?
I do.
So you could kind of translate a little bit to help them understand what was going on?
And I did.
But you weren't being told the truth?
Correct.
Did anyone along the way suggest to you that there might have been some medical malpractice here?
A few of the medical professionals did make it known that I should probably have the case looked at.
And so after she died, well, actually before she died, you did.
I did.
And as part of that process, you eventually got the medical records.
Yes.
And you were with your training and background, you were able to see exactly what happened.
It was it was on the first note post-op that there was a hole in the ethmoid sinus and that heparin was administered against orders. That ultimately led to where she landed.
And so this is a big hospital that we're talking about here. We won't go into names and so forth, but it's a big hospital. Mm-hmm. And so did they step up to the plate, say, we're sorry, and we're going to compensate the family for our mistake and having...
No, it was a 4 long years of depositions and back and forth and in your office and in the sitting with Stevie, going over it, rehashing it over and over again. It wasn't an easy process, no.
When you go through a medical malpractice lawsuit like this involving a tragic death, how old was Terry when she died?
40.
40 years. 40-year-old mother and wife mm-hmm. died. When you go through a medical malpractice case with an attorney, over those 4 years, things happen, right?
Yeah, a lot of things happen in 4 years.
Depositions get taken. Your deposition gets taken. Steve's deposition gets taken. And you have to help the attorney, at various times. Each time the telephone rings, each time you get an email, each time you have to do something, it brings it all back, doesn't it?
Every bit of it.
It's a real horror.
To this day.
So, how hard did the hospital fight this?
Harder than I thought they would, for sure. I don't think that they thought there was any wrongdoing within that facility or with that particular physician. I'm not sure why we fought or why it was fought so hard or drug out for so long. But no, I don't think ever saw a malpractice suit or losing to a malpractice suit.
But the jury did.
Yes.
And what did the jury find?
That it was medical malpractice, and all 12 anonymously voted medical malpractice for Terry.
And what was their award?
$12.4 million.
Did Steve and Terry and Steve's daughter get $12.4 million?
No, not even close.
And why not?
Well, the medical malpractice cap in Louisiana doesn't award victims or their family an outrageous number of $12.4 million for medical malpractice. It's what the jury thought he should be compensated or they should be compensated, but it doesn't necessarily mean that's what they get.
So the award was very greatly reduced.
Absolutely.
Okay. And so with that in mind, what did you learn by the end? And this was 2024, right?
Correct.
When this happened. So at the end of the whole ordeal, what would you like people to know about the medical malpractice system in Louisiana?
That surprisingly, the medical malpractice caps for the state of Louisiana were set in 1975, and they've not been reviewed or changed since.
Would you say that medical malpractice victims in Louisiana get full and fair compensation like they would in any other personal injury case?
Absolutely not. Louisiana has the lowest medical malpractice caps of the United States. Our rights or compensation for injury and death are far lower than the rest of the country.
Can you think of any reason why people who live here in Louisiana and who are victims of medical malpractice should have any less rights than people in any other state?
No.
Is there something unusual about us that we tolerate a system that compensates people with $1975 that you can think of?
No, because I'd like to pay $19.75 prices for milk or groceries or gas.
So let me talk to you a little bit more about the medical malpractice system and why you're here today. Why are you here today? What is your purpose in giving this testimony about your own experience, both as a medical professional and as someone who's observed the Louisiana medical malpractice system?
So this obviously hits home for me, but to raise awareness, because if things aren't changed, then medical malpractice won't change.
Do you think there is a connection between Louisiana's abysmally low health care ratings in virtually every field? U.S. News and World Report, Cunningham Group, you name it. Louisiana consistently ranks as 46th, 48th, 49th, dead last place as far as medical care in the United States. Do you think there's a connection between patient safety and a weak accountability system provided by our medical malpractice law?
Absolutely. And accountability is key. If they're not held to a higher standard or facing a higher penalty, then no one is going to change their way. We're not going to slow down. We're not going to voice when we need assistance or, it's time to be even done in this practice.
What would you like the people who make up the Louisiana legislature to do or to know and to do about Louisiana's medical malpractice laws to increase patient safety and accountability?
Well, it's hard when you're sitting on the opposite side of the medical field and you're the family at this point or the friend or the loved one. It's hard because for me, for us, for the family, she's not a number. She is everything to her family and her friends. She's the rock. And so value to us is priceless. So it goes back to quantity over quality and being a number in an operating room or another number in the hospital. What what I'd like to see is that families are compensated fairly. And honestly, Chip, no amount of money, there's no single dollar sign that takes away the pain or the suffering or the fact that she's not coming back. And for others, the fact that they're permanently injured. That doesn't change. So the medical malpractice cap that sits in the state of Louisiana, and just to put it in perspective, a life flight from the North Shore to the South Shore here is $26,000 after insurance. That was her portion. If we don't understand that people aren't living on $1975, and again, not a single red cent will change or bring her back. But it does help that family, the family that's suffering the loss or paying the medical bills for the rest of their loved one's life because they're permanently injured and they'll require 24-hour care or a 24-hour caregiver or supplies, and just the cost of living on a $1975 doesn't make sense.
When you talk about $1975, I think statistics will show that inflation since 1975 is over 400%.
Absolutely.
You know, I think if you do the math, the cap of $500,000 in 1975 would be worth something like $2.75 million today,
Yeah.
if in today's dollars and so forth. Did you find out also that the wrongdoer, the surgeon in this case, or the resident in this case who ordered the anticoagulant to be, to be administered when she shouldn't have, did you find out they only have to pay $100,000?
Yes, which is insane. Because what's going to prevent it the next time? I mean, to a family like hers, $100,000 may be a lot. But in hindsight, $100,000 today is nothing. And so to be responsible for someone's death.
And a long and agonizing death in this case.
Yes. The amount is almost like a drop in the bucket. And it doesn't make sense.
We all have consequences when we do something wrong, even when we don't mean to do something
Correct.
wrong. We didn't mean to hit that person with our car. We didn't mean to drop something on somebody or whatever. There are consequences that come from it. An apology is good, but something needs to be done to compensate the victim for their injury, for their loss. We really don't have that in Louisiana for medical malpractice, do we?
No.
And if you don't have consequences, it just keeps happening, doesn't it?
Actions don't change.
Yeah, actions don't change. So the people in this particular case that you were involved with, they never really faced the consequences of their own negligence, did they?
No.
Well, Jessica, I want to thank you for coming here today and sharing your experience with us and with our viewers, because I think this is going to cause a great awakening among the people in Louisiana. And thank you for spending your time and coming over to do that. If you'd like to learn more about Louisiana's brutal medical malpractice system, please visit our website at patientrightsla.com. And won't you join our cause and help us persuade the people in the Louisiana legislature that the time is long since come to change this draconian and cruel law and compensate people in Louisiana like the rest of the country. Thanks for watching.
Thank you for listening to Bayou Justice. I hope today's episode has given you valuable insights into the complexities of medical malpractice in Louisiana. If you'd like to learn more about our mission or get involved in our advocacy efforts, please visit patientrightsla.com. Your support can make a real difference in the lives of patients across our state. Remember, together we can create a fairer, more just healthcare system for all Louisianians. This is Chip Wagar, and I'll see you next time on Bayou Justice.